Things that I wish I knew before starting my urgent care rotation as a nurse practitioner student, and this is part two. Okay, this two topic will literally make like most of your urgent care day. So number three we have is cold, flu, sinusitis. So you're going to see a lot of upper respiratory complaints all day long, and one of the biggest thing you need to learn is bacterial versus the viral, right? So because not every patient with congestion needs antibiotic, most cases are, and almost like all, like most cases are viral and should not be treated with antibiotic, but rather give like symptomatic treatment like saltwater gargle, over the counter nasal sprays like Flonase, humidifier, hydration, and allergies medication over the counter like Allegra, Zyrtec, and Sudafed if appropriate. And please check their like ears, throat, and lungs. A lot of sinus pressure patients usually have like ear infection, strep throat, pneumonia, or viral upper respiratory infection. But if the symptoms are bacterial, then our to-go antibiotic is amoxicillin or Augmentin. That will cover for like upper respiratory infection. But please educate patient on antibiotic resistance. This is huge in urgent care because many patients expect antibiotic in urgent care for every cold symptoms. A big part of being a nurse practitioner is education, like why they can have antibiotic for viral infections and all that, right? And our number four is workman comes, x-rays and all that. So in urgent care, that means like injury all the time, right? So you'll see a lot of patients for like hand injuries, finger fractures, ankle sprain, muscles like pulled muscles, fall, back pain, cervical radiculopathy, and all that that's related to their workplace. So like know the basic anatomy, common like fractures patterns, know that, and know like basic x-ray interpretation. So even the radiologist gives a final read, you should still be able to like look for pneumonia, fractures like common little fractures and all that, right? So for example, let's say like, oh, okay, the patient walking like right before the urgent care closed for pneumonia, and radiologist already left the house, right? So you're the only one like who can interpret the x-rays and like order the antibiotic if needed. So yeah, that's a big deal. So you are not going to send the patient without antibiotics if the patient is like really needing antibiotics, right? So you should be able to interpret it like basic x-rays. Number one is like pneumonia. Look for consolidation, um, like infiltrations and all that for pneumonia. Look for the landmarks and all that. That's very important. That's one thing I need to get better at, like looking x-rays. One time I feel like, oh, I got this, and like the x-rays are so different, like yeah. So yeah, I still need a lot of practice, but yeah, these are the things that I would study and prepare myself before my urgent care rotation. Thank you, everyone. Bye bye.